Y'all know what time it is. It's time for nursing school updates. If you're a nursing school student, aspiring nursing school student, or into the health sciences, or you just like this pretty face, I want you to stay tuned. Now, I'm going to be dispersing some of my funny Facebook posts about nursing school throughout the video. In my last video, I actually highlighted the posts, but I totally forgot to do it. So I'm just gonna randomly throw them up there. So just stay tuned for that because they're funny. Love you guys. Hey y'all, it's your girl Tammy. I'm coming to you a little bit early. I am now in week 7. Holla for $2. Yes. I am in week 7 of nursing school. Semester 1, week 7. So in my last video, I told you that I was going to give you monthly updates, and well, I'm sitting here and I feel like this is a good time to give my second update. Technically, you should wait one more week, but I got love for you all, so you're going to get it a week early. So I don't even remember how many tests and quizzes I have taken since the last time I spoke with you. So I'm just going to start randomly, and I'm going to start with Fundamentals of Nursing lecture because I feel like I've had some victory since the last time we spoke, specifically with the pre-lecture quizzes. So we take a quiz before every single class in fundamentals. So every Tuesday I get to freak out about what I think may be on the exams and try and review flashcards and brush up on some last minute facts in the hopes that I can pass my pre-lecture quiz, because to date, as of my last video, I hadn't passed one yet. Took 2, maybe 3 pre-lecture quizzes, and all of them were 70s. Well, yesterday I took my pre-lecture quiz for in our book chapter 42. It's fluids, electrolytes, and acid-base balance, and your girl got a 90. I can't believe it, and I'm so happy and I'm so proud of myself because I really did take the time to do what they call the spotlight video. It's where the professor goes through the chapter and highlights all the important stuff on a video. So I meticulously went through it. I highlighted in my book, and then I went and I read through the chapter and took very meticulous notes. And the day of the quiz, I did some of the same professor who does the spotlight videos does the flashcards. So I actually didn't finish the flashcards, but I did a good amount of them. And going through the flashcards helped solidify a lot of what I had read. And I credit the flashcards with making me get this 90 because, just because you read, especially, okay, my whole philosophy when it comes to preparing yourself for class, I believe that the first time you read, you're not really reading for understanding, you're reading for just familiarity of the text, so that when your professors are going over it, you recognize what they're saying and just getting a deeper understanding of what they're trying to explain. And because you recognize it, you can be like, oh, okay, I understand how this connects to this and how that correlates to that. And then after you've had your lecture, you can go back and you can now read for complete understanding, connect all the dots, and really take, really pare down your notes and weed out anything that maybe you wrote down just as a copy, because if you're just copying from your book, you're not really taking notes, you're just copying from your book. But when you take notes in your understanding, you really internalize that information. So that's how I do things in nursing school, and you know what, it's working for me. I'm passing all my classes right now with, I think, AB average. So yeah, I got the 90 on the pre-lecture quiz. And then about a week or two before that, we had exam number 2, and I got a 90 on that exam. So first exam, I got an 86. Second exam, I got a 90. I am so proud of myself. My biggest concern, my greatest worry, even my greatest fear when it came to nursing school is that I would not be able to dedicate the time or have the energy or even the willpower to be in the books like I'm supposed to. And I haven't let up. Listen, no defeat, no surrender. I have been plowing through, and I have had some weeks where I've been like, oh my God, this is a lot. And I've had weeks where I'm like, at the end of the week, I'm so exhausted. And then I'm busy on the weekend and time with my daughter and work and all this stuff. But I am going through, I'm chugging forward like choo choo. So that's fundamentals of nursing. Let's see what else. Then we have clinical fundamentals of nursing skills lab. So this is where you kind of like take what you learn in lecture and you like practice it hands-on. But I think maybe because of COVID, maybe because we're not fully like in person. We've actually lately been doing a lot in person, but being in your book and actually doing things hands-on, two different things. So Monday I have my skills class, and we had what they call a practice day, and oh my God, I'm so grateful for that, because everything we learned in the books, everything we reviewed, everything we went over, we did it hands-on in the classroom. Like there were stations and we did it. So we made beds, we put on TED hose, which I hope and pray that it's easier on a human being than it is on a mannequin, because them TED hose, listen, I was sweating. Put the bucket right here, sweat pouring down. It was serious getting those TED hose on. And we did body positioning. I actually positioned my partner in the bed. We did 30 degrees lateral. We did side lying. We did fowlers. We did high fowlers. I did a lot of positions. We even did the oxygen therapy. We did the cannula. We did the face mask. We did the rebreather mask. Like we even got to like play with the oxygen and like turn it to where it was supposed to, like, nasal cannula can do 0 to 6 liters, and I like turned it up to 2 liters. And the face mask, you can do 6 to 12. Well, face mask, you can do 6 to 12. So like I turned it up to 7, and you could hear the oxygen. It was awesome. Listen, I'm a good person because I stay getting interrupted while I try and make these videos. Ciao. Anyways, last time, I was talking about the oxygen, and I just thought that was so cool. You could hear like the oxygen, and then you like put the hose on it, then you put the mask on your mannequin. Super cool. So, and then the best part about that was I got to take manual blood pressure, and I like actually heard things through my stethoscope for the first time, and that was it was a good experience. Because okay, here's the thing, there's a huge difference between being book smart and like having actual hands-on experience. I didn't want the first time I take a manual blood pressure to be on a human being who's like actually in the hospital not feeling well. I want the first time I take a blood pressure to be on my wonderful classmate. So child, I took me this blood pressure, and the first time I did it, I squeezed the crap out of my partner's arm, and I felt so bad. But the truth is listen, I am good when it comes to reading. I am good when it comes to taking the test. But don't tell me to like regurgitate it and do it in person the same way I did on the test, because when I was taking the test, I had time to sit there and be like, and like take my time to critically think. So like, yeah, I was super lost on skills day, but at the end of it, I felt so confident and so empowered. So yeah, skills is like killing it. And so for this class, there isn't much like actual work. We have these modules on ATI that we do for this class, but we did a bunch of them in the excuse me. Whew. We did a bunch of them in the first few weeks of class, and most of them, like, I haven't done one in quite a while. So we're actually coming up next week. Okay, next week we have our first exam for skills, which I already know I'm gonna kill it. I'm going to spend the weekend just rehearsing everything, like going over all the chapters of everything that we've done to date, just to like make sure like I'm really like, but after that skills day, I feel like I can do anything. The one thing that I think has been like really clutch in my whole like nursing school experience is that I have excellent recall. Like when I have my experiences like in the class, and when I'm like, that's why I never miss class ever. No reason to miss class, so it doesn't matter. But I have excellent recall. Whatever the teacher emphasizes, I always remember those points. 10. Ciao, boo. I'm getting interrupted again. Yeah, so I'm super excited. I got to use my stethoscope. I got to position my partner. So now, you know, you're in supine. You know, you need 5 pillows, head, feet, both arms, back. I'll never forget it. Moving on. Let's see. Clinical. So we started clinical 2 weeks ago. And I don't know if I talked about it in my last video because I don't think I had actually been to clinical when I did that video. So clinical starts like 4 to 6 weeks into the semester of semester number 1. And you don't go to the hospital right away. We actually have our first month. The first month is actually on campus, and the first week was just orientation, getting to know each other, getting to know the professor, requirements, expectations. Second week was like a seminar, and it was like on critical thinking and care plans and I know, U Central. It's something that's part of our tuition, and we finally got access to it the day before we went to seminar, and it has Davis's drug guide and all sorts of like really good handy information that's going to help us with our care plans. We found out what our clinical assignments are going to be. Not telling you because don't nobody need no stalkers, okay? But we're gonna get fit tested for an N95 mask. So I don't know if they're trying to stick us in some COVID rooms. I don't like that. I got a baby. They've been nesting me in no COVID room. But regardless, in skills, they taught us proper, you know, hand hygiene. And you know, one thing I've learned is that it's not just about like the proper way to like wash your hands. It's also about like vigorously rubbing, not just like a passive rub. It's like a vigorous rub. Like that's what's like, you know, really like killing them germs. Anyways, okay, so that's clinical. There's not much to say there because we haven't done that much, but tomorrow I have clinical on campus, and they gave us this critical thinking exercise to do, and I'm like, I had to look up all the medications that were in the little scenario because I didn't know what any of them were, and I had to look up like a couple of like the abbreviations. And you know, the hardest part about this, especially now because we're right in the beginning, is like you have like an inkling of what to assess maybe, but it's just like all the insecurities of not knowing, like, is my train of thought right? Like that's like my current like okay, and then adult health assessment. This class just has me like, so every class I really feel like I totally grasp everything. I feel confident in them. Even if I have moments of insecurity, like overall, I feel very confident in my classes. But this class makes me feel dumb. Adult health assessment. And the reason is, it's like, especially as a first semester student, I feel like everybody should be teaching us from the point of view that we know nothing. Like, that we are blank slates, we have no experience, we have no knowledge except for what we read in our book. And I feel like no matter how prepared I am for this class, no matter how much I've read, that I am not me, that the class is being asked things and to critically think in ways that we don't have the capacity to think, and we don't have the resources, the tools, or the knowledge to answer it properly. And I'm not talking about tests, I'm talking about just, well, I am talking about tests, but more so I'm just talking about like the actual class. And like, my professor is like A1. I love her, but it's just, the class just makes me feel dumb. And then I take a test and I do well, and I'm like, well, I guess I'm not dumb, and I guess I am learning something. But yeah, I feel like, listen, I'm rambling, but I'm just trying to get all of this out before I get interrupted again, and I want you guys to have this knowledge. So I think when I left off, I was saying how adult health assessment makes me feel dumb, but because I did well on the exam, I'm like, well, maybe this whole challenge to my, like, you know, even though I feel dumb, like, clearly the challenge is working. Like the knowledge that's being thrown out and the forcing me to think in a certain way, like, clearly it's working. So, like, I can't hate on that professor of mine. She got something, like, she does things differently, like, than all the other professors. But I think what she's doing is working because, oh, I did well on the exam. Yeah, I got a 95, y'all. So I'll tell you this. I didn't originally get a 95. I originally got an 82.5. That was my raw score before any item analysis. And child boo, I was so happy with that 82. Excuse me, I was so happy with that 82.5 because I was like, when I was going to the exam, I was like, no. I was not expecting some of the things that were on there, especially because this is an adult health assessment class, and there was like there were like 5 questions, baby, about like infants and children and things like that. And I was like, I didn't really focus on that because I'm in adult health assessment and not pediatrics. Or not, kiddie assessment. Okay, so I didn't focus on that. And then I had studied really hard on like the skin and like lesions and stuff. And there were like, I think I had like 2 questions, like two on skin and lesions. And so, like, I really feel that my knowledge from my fundamentals class, let's talk about clutch. It's clutch. I really feel like that knowledge really helped me succeed on this test. So I know I earned that 82.5. There were many of my classmates who failed that exam. Failing for us is 76 or below. Many of my classmates failed that exam. And I passed it without item analysis. And after item analysis, I had 95. So, I passed it. So yeah, I feel way less dumb, but I'm still not 100% confident. We have a performance exam coming up in this class. So this coming Sunday is our practice day, and then the Sunday after that is our performance exam. Now that got me nervous. And I'm typically not nervous about these things, but the truth is like I said, book smarts, test smarts, hands-on, wah wah. So I have been, like, I'm pretty much for the most part a paperless student. If I'm printing something out, it's pretty serious. I printed out the rubrics for the performance exams, and I have been writing out every single step that I'm going to take. Every single question I'm going to ask, I have written it out for So we get to choose between, for this first assessment, skin and the cardiovascular and peripheral system, or skin and the lung and thorax, I think. Lung and thorax system. So, I'm super nervous. This is what I'm getting ready for, people. Last but not least, we have nursing, math, and pharmacology. This class I love because it's the only class that I don't have to put a ton of energy into. So I come to class and I make sure that I pay very in-depth and close attention while I'm in class, because when it comes time for the test, the night before the test, well, what I do is there's always homework before the test. So the homework, I make sure that I'm very meticulous in how I do the homework. Of course, I'm shooting for an A, but it's not really about the grade. It's making sure that I can do the work on the homework, because if I can do the homework, I can do the exam. So I take my time with the homework. I go over it many times, and the first time I go through it, I don't look at the book, I don't look at notes, I don't do anything. I just do the homework. And then usually I can get through all 20 questions, no problem. And then if there's like something, usually there's something I am not able to get, and it's usually asking me to like write out, like a list of things, or write out a process or something. And so I'll like go to the book and look it up, or if I have a question, I'm not certain about something and I want to check my answer, I'll go and I'll look for a similar problem, or I'll go to my notes and look for a similar problem and compare it. And then when it comes time for the test the night before, I go through every single chapter and I do all the practice questions. Yeah. Like, even if we did the practice questions in class, like I have a section in my, I use OneNote to take my notes. So like in one of my notebooks, I just, thank you. Appreciate you. Thank you. So in one of my notebooks, I label it test practice number 2. So that's what I did for this one, and I just do as many examples for all the different types of things I know she's gonna ask, and if there's anything to memorize, I take that time. Well, typically I've already memorized it in the course of just going to class and doing homework. It's usually memorized, but if for some reason it wasn't, I will make sure that I memorize anything that needs to be memorized. So we took a test today. I don't have my grade, but I know I passed it. First exam, I got a 94. I'm sure I'm going to get a 95, 96, 97, 98, 99, maybe even 100. Who knows? She even called me up to help correct her on something from the exam. So, listen. I know I passed it. I have no worries about this class. Anything exciting about this? So far, we've learned about 2 drugs. One is insulin, the other is heparin. And we know that both of them are high alert medications, which means you need 2 nurses to verify the order, 2 nurses to verify that the math is correct, and it requires close monitoring. I know that insulin is measured in units, ordered and measured in units. I know that heparin is ordered in units but given in milliliters. There are 2 types of insulin, and one is the one that you use as the anticoagulant. Don't ask me which one. I think it's the sodium heparin, whatever. And then there's the one that you use to like flush the IV to keep it patent. Patent is to keep it open. See, I learned something new. I had to Google that. Yep. Google is gonna be your best friend. And I know that is between 10 and 100 milliliters. And I think the 10 milliliters is for kids and the 100 milliliters is for adults. And part of the reason why it's high alert is because if you switch the 2, as in the one for flush with the one for the actual like anticoagulant properties of heparin, you can kill somebody. Yeah, so don't do that. Yeah. Do all your checks. Make sure you observe all the patient rights of administration. Yep. So this has been interesting, people. I've been interrupted a lot, but semester 1, month 2, we're doing well. We're happy. Don't give up. That's all I gotta say. If you make it into nursing school, you know, of all the people that applied to nursing school, you made it in. And of all of us who made it in, we're still standing. That means we're doing well. We're gonna be nurses, y'all. Actually, I say this to myself every time I pass a test, every time, I don't know, I have a victory in school. I say to myself, and I say to my mom, and I say to my daughter, even though she doesn't understand me, I'm gonna be a nurse, y'all. I'm gonna be a nurse, y'all. It's exciting. I am learning so much, and I am so grateful that I have this opportunity. So keep hope alive. Remember, no defeat, no surrender. Nursing school is ours. We gonna do this. Keep your head in them books. I actually had a professor say that you need to spend 2 hours per day per subject studying. And that instantly made me freak out because I was like, I don't have 10 hours in a day to study. I got a job. I got a kid. I actually have to attend class. I don't have 10 hours in a day to study every single day. So what I have done for myself is I make sure that I pick up something every day. So, like for instance, I know that I have 2 big tests coming up. I know that I have to practice for my performance exam and that the exam is coming up. I know that I have my fundamental skills exam coming up. I know that I have pre-lecture coming up. So for those 3 classes, they're gonna get all my attention from now through the next week or so. They're gonna get like the majority of my attention. Yeah, but every day pick something up and don't be lazy. Don't be spending time on Netflix. Don't be spending time going out all the time. Listen, pick up something every day. Dedicate a good amount, a good portion of time to this nursing school thing. Listen, I'm in an ADM program. It's 1 year and 4 months. You know, for 1 year and 4 months, we can sacrifice a little bit. For 1 year and 4 months, we can say bye Netflix, bye Hulu, bye bye bye, bye 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 bye. Sorry, guys, I must be delirious. I need to actually get back to studying, and I need to get back to working. So I want to thank you for the support. I want to thank all the people who watch and have reached out and have shown love. I'm super excited for this journey, and I pray that everything that I do, that it helps you out. I love you guys.